Hey, Nurse Sydney here, and I thought today we could go over some frequently asked questions that I asked you guys over on my Instagram. If you don't follow me there, make sure you go give me a follow, and let's head into this little Q&A. First question is natural birth likely with HSV2. So HSV2 is short for herpes simplex virus, so herpes, and it is safe to have a vaginal delivery with HSV as long as you don't have any active lesions. And active lesions means active blister. Obviously, this is something that you're going to talk with your OBGYN or midwife about, but most of the time it's completely safe to deliver with HSV. You want to be taking your acyclovir during, usually it's like starting at 36 weeks, just to prevent any active outbreaks for that last kind of month of pregnancy. If you do have an active outbreak, it is recommended to have a C-section for people who do have active HSV2, but it is still definitely an option to have a vaginal delivery if you have no active lesions. But definitely talk to your doctor again about all of this kind of stuff, and they will design something that is perfect for you and your baby and what works for you guys. Question number 2 is from Amanda, and she said 3 weeks postpartum from a VBAC, still sore. Is that normal? Unfortunately, yes, a certain amount of pain and discomfort is normal while you are recovering. It can last up to 6 weeks, usually is what we say. So first off, I want to say congratulations on a successful VBAC. VBAC stands for a vaginal birth after a C-section. Great job. That is, I know, not an easy feat, and you did it. So congratulations. I do say that a certain amount of soreness is normal, but you do want to check with your doctor if you're having consistent pain that isn't being resolved from, over-the-counter Tylenol, Advil, that kind of stuff, and it's not improving. So if it's continuing to get worse, I would say follow up with your OBGYN or doctor, midwife, whoever it is who's been following you, follow up with them sooner, just to get checked out and make sure that everything is healing okay. Because if you did have some tearing and some stitches down there, sometimes, rarely, but sometimes it does need to be checked out sooner, and there could be infection, all that kind of stuff. So just keep a close eye on it. But if it's just general tenderness, that's usually normal. Take Tylenol, Advil, as long as you're able to do that. And then sitz baths are really great, ice packs, all that kind of stuff, and just take it easy. Really try to relax. Halima said, does eating gum after a C-section really help with avoiding constipation? So Halima, this is technically something that we say you can try, is chewing gum right after a C-section. It can help to stimulate your bowels and stimulate the juices, get everything flowing. Constipation after any kind of surgery is pretty normal, but especially abdominal surgery, it tends to kind of put your bowels on this they forget what they're doing. So they stop working for a little bit. Chewing gum is one way. I have seen it work. A lot of people say it also helps to prevent, that gas pain from building up. Other things people have tried is peppermint tea. I've heard that works really well. I mean, it's an easy thing that you can do if it's going to work. It's not like it causes any harm, so may as well give it a try. Best advice for moms hoping for VBAC with next baby. So again, VBAC is a vaginal birth after a C-section, and there's lots of different kind of avenues you can look into with your OBGYN before you actually attempt a VBAC. So there are certain people who we will say, absolutely not, you cannot have a vaginal birth after a C-section. And these are people who have had a C-section within the last 18 months. This increases your risk of what's called a uterine rupture. So basically that scar where they did cut into your uterus rupturing during labor. So we want to make sure that that's been healed for 16 to 18 months. It varies upon provider. And then if you've had a T incision, you cannot have a vaginal birth after C-section, again, for this risk of the uterine rupture, or if you've had multiple uterine surgeries in the past. So if you've had previous C-sections, more than one, we usually say, that's it, you can't have a vaginal birth after a C-section. There are, of course, more reasons that you can talk with your OBGYN about, but I usually say the absolute best candidates for a VBAC are those of you who did go into labor with your last baby and ended up having a C-section for the fetal heart rate. So something to do with the baby. It wasn't necessarily because you couldn't dilate or like a failure to progress. Those kinds of situations are a little bit tougher because that's more so usually your anatomy, so maybe your pelvis or something along those lines. But if it was the baby whose heart rate was misbehaving, or you got a fever and the baby's heart rate went really high and you had to have a C-section, or if the baby was breech and you never actually went into labor, you just did a scheduled C-section, these are all really good options for having a vaginal birth after a C-section. My best advice for this is to just keep an open mind, talk to your healthcare team and tell them I'm really interested in having a VBAC, and see what kind of advice they give you and what things you can do to prepare your body for birth. Malia said problems with milk coming in. So this is common. It is very common. Keep in mind that your milk doesn't come in for 3 to 5 days postpartum. So those first 3 to 5 days, you only have a small amount of colostrum. After that, that's when your actual milk comes in, so the larger volume of milk. If you're finding your supply is low once your milk actually does come in, there's a few things you can do, but always remember that your milk is a supply demand. So the more you pump or express or feed, the more milk it will equate to. So if you're finding you're not having a large enough volume of milk, in between your feedings, I want you to pump. And this is really gonna help to stimulate your breast to produce more milk. Also make sure you're staying really, really hydrated and that you're eating enough. These are also things that might decrease your milk supply if you are dehydrated or if you're not eating enough. And if you're doing all of those things and you're still finding it's not enough, talk to your doctor. There are actually medications and things that we can do to help increase your milk supply if that is becoming an issue for you and leading to weight loss in your baby. Kelsey, who I met at the NICS ambassador event, she is absolutely amazing, a ray of sunshine. You need to go follow her if you don't follow her already. But she said, what made you decide to be a nurse? And this is a great question that I do actually get a lot. And I was one of those weird case scenarios where I always knew I wanted to go into medicine. It was always a passion of mine ever since I was like literally 6 years old. I was asking Santa Claus for first aid kits and medical books and all that kind of stuff. And I never said, hey, I want to be a nurse. I just knew I wanted to work in a hospital. I absolutely loved the hospital. I thought it was the coolest place on earth. So once I decided I wanted to do something in the medical field, I started looking into it, and nursing seemed like a really good option because it was a 4-year undergrad. So I didn't need to go to school for a really, really long time because I didn't necessarily want to go to school for like 10 plus years. And it was a great job. So I got a job after an undergraduate degree, which I really liked. And I also liked that nurses spend the most time with their patients. So unlike a doctor who kind of, is in and out of patient rooms, you're spending a whole 12-hour shift with your patients, getting to know them. And once I was in nursing school, I figured out that I really loved women's healthcare, specifically labor and delivery. I thought it was the most magical place on earth, and I still do. I absolutely love it. But yeah, that's kind of my story of how I got into nursing. I am definitely in the right profession. I can't see myself doing anything else. And I get the question a lot of if I would, do social media full time. And the answer is no. I would never leave bedside. I love labor and delivery. I would maybe reduce my hours once I start to have a family of my own, but I always say it fills my cup. Like being with my patients every day fills my cup. And I love teaching you guys online and doing social media. But what I love the most is helping babies be brought into the world, helping moms, helping women just feel empowered during birth. That is the most amazing part of my job that I absolutely love. More about me. Would you ever feel comfortable talking about your eating disorder? If so, how does work affect things? Skip ahead if eating disorders are triggering for you, or talk about mental illness is triggering for you at all. I won't go into too much detail. So if you guys don't know, I have a eating disorder recovery symbol tattooed on my wrist. A couple of you guys have noticed it or asked me what it actually means because it kind of looks, some people say it looks like half a heart or something. But yeah, I did have an eating disorder, and I'm pretty open about talking about it, just because I think that there's not enough discussion about mental health, and especially as a young woman, I think that eating disorders are something that is a little bit taboo to talk about. And I personally like to share my story, because if it helps someone out there who might be in a similar situation, then I think that that's a win. But I did suffer from an eating disorder while I was in high school, and I did go through an intensive program. I'm super comfortable talking about it. I basically had like generalized anxiety disorder that kind of spiraled into my stomach. So anytime I would eat, I would feel really, really nauseous and sick. And then it kind of led into this fear of food and food restriction. And it spiraled kind of out of control, to be honest with you. I became really, really sick, and I was hospitalized for it. So I did get help from medical professionals. My mom, my whole family, they were all so supportive. And I honestly wouldn't be here today if it wasn't for them pushing for my health and making sure that I got the care that I needed. So I'm super grateful for that. And I just want to say, if any of you guys are struggling with eating or mental health, anxiety, depression, anything like that, especially during pregnancy and after pregnancy, this can be a really difficult time for that. I want you to reach out and get help, because you are not alone. And I've been there, and I am on the other side, and I'm so much healthier than I once was. And I can only thank my doctors and my family for that. And, you know, a lot of hard work on my end, but reach out if you need help, because you are worth it. You are so, so worth it, and you are worth getting help for, because I struggled for years with severe anxiety. And whenever people they look at me like I have two heads when I say that, because I'm so calm and collected now, but I still struggle. I take medication daily to manage my anxiety, and I talk to a therapist at least once a month. I used to at one point talk to her every week, and finding the right therapist is everything. That really helps as well. But I have well managed anxiety now, and I am happy to say that I can eat whatever I want now, and that I actually love food, and I want to nourish my body and move my body in ways that makes me feel healthy and happy and confident. And that took a long time to get there. I'm just finally kind of getting there at 25 years old. I started my eating disorder journey when I was 14. So it's been a long haul, but I am happy to say that I'm healthy. And again, if any of you guys are struggling, please reach out. I always have resources linked in my link tree. If you guys have any other questions or anything like that, resources, places to talk to, I have it all linked in my link tree for you to check out.